A nationwide search is underway for a rare type of blood urgently needed by an Australian mum awaiting heart surgery. Joining us now is Dr. James Daley, Medical Director of Pathology Services at Australian Red Cross Lifeblood. Really appreciate you joining us. Thank you for making the time. Just tell us, is there any update? What's the latest on that situation facing this Adelaide mum, Amira? Have you found any suitable donors?
Yes, so we've launched the national appeal last week, and we've had a great response from donors turning up, Group O and A particularly, donors we're looking for, and we've had many thousands of donors turn up and make donations. We have 4 donors in Australia that are a perfect match, and some further donors who aren't quite a perfect match but may be acceptable. And we are in the process of receiving 2 units from the UK that are also a perfect match for Amira, and we're negotiating with some other international blood services to get further units imported from overseas. So we're making good progress to getting the number of units required for the surgery.
Yeah, remarkable to think she needs, I think it was 20 bags of blood in the hospital ready to go for that surgery to go ahead. When we look at having a rare blood type, what proportion of us do have a rarer type of blood, and how hard is it for you to find donors?
So we define any type that's less than 1 in 1,000 donors as a rare blood type. In Amira's case, it's a combination of blood types which each individually aren't that rare in themselves, but the combination she requires is quite rare, and we're estimating around 1 in 5,000 to 1 in 10,000 donors may meet that phenotype requirement. Importantly, it does include a blood type that we don't routinely test donors for. So all the donations as part of this appeal, we're doing manual testing for some additional blood types to make sure they're a perfect match.
Okay, more broadly, James, how are our stocks of blood faring? Do we see stock levels fluctuate much at different points of the year? Do we usually have a pretty solid amount ready to go?
Look, always in winter we do have some increased rates of donor cancellations and reduced appointment bookings due to just the seasonal cold and flu viruses around. And so we're experiencing that this winter similarly to previously, but we have been able to maintain our inventory and supply hospitals with the blood they need throughout this time. So this appeal is really specifically to search for Amira's blood. Any donations that are made, obviously, though, won't be wasted. We'll use them for our general hospital supply. We do need 33,000 donations a week to meet the demand for blood and plasma in Australia.
33,000 donations a week. That sounds like a lot. How often do we see patients experience adverse outcomes because they simply don't have access to the blood that they need?
Oh, look, that's very rare. We're normally able to rally our donors and find appropriate blood for patients, even with rare blood types. We are part of an international network of blood services that help supply rare blood types when needed. Amira's case is probably one of the most challenging we've faced recently, mainly because of the volume of blood she needs as well as the rare phenotype.
So, James, we all lead very busy lives, and I'm sure that most of us would like to try and help if we can. What's the actual process these days of giving blood? How much time does it require from a donor? What's the process?
Look, it takes less than an hour to make a whole blood donation. So if people are otherwise well and aged between 18 and 75, they may well be eligible to make a donation, and we get them to book a donation on 13 14 95 or make an online booking at lifeblood.com.au or the Donate Blood app.
James Daley, really appreciate your time. Best of luck with the hunt. We'll keep an eye on that and see how you end up. But we all wish Amira the best in getting that surgery and getting the help that she needs. Thanks so much.